So this is an example of the preformed post and core. So I'm just going to quickly demonstrate how to place this. So you got here the pre-prepared tooth on the model, perfectly conventional prep. Here is the preformed post and core. Like all of the edelweiss system, the treatment you give to the tooth is normal etch, bond with the conventional materials as you would for any composite. Again, I prefer to air braid everything. Cleanliness, adhered. It improves the bond, you're increasing the surface area. So the preparation of this is, again, it's in preformed parts. It fits in like that. And I will just show you the burrs needed for that. So the burrs we use are the edelweiss post hole preparation burrs. And they are sized for the post that you are using, like in any other system. There is an advantage with these, apart from the fact they are made for the appropriate post, of course, but the way they are constructed really works. They stay sharp, they don't clog, and they are very, very safe and self-guiding up inside the root canal. There are details on the Dental Practice Systems website about how this works. The resource provided is very, very useful. Normal latch grip, normal slow handpiece. Pre-shape the tooth. Tooth conventionally prepared, conventionally bonded. What I will then do is backfill the canal as we would do with flowable veneer bond, conditioning the post and the underside of the core. Air dry, blow as usual to remove excess carrying solvent, usual 10-second cure, completely conventional. Just make sure you use the edelweiss veneer bond because it's matched chemistry. And then, having backfilled the post with the edelweiss flowable, seat the post precisely where you want it, finesse any excess to wherever you want it to be. If I want to build up the core directly with composite, then I will do, having previously bonded it with the edelweiss veneer bond. What I have done in the past as an emergency treatment, if somebody has come in with a broken tooth, I will do all this and then build the whole thing up freehand with composite as a temporary crown. Okay, just continuing to clear away the excess. All this information is available on the Dental Practice Systems website. Very good resource, and cure perpendicular because there's a light guide built into the construction of the post, which means it will cure right up to the very, very tip. And I would cure buccally and palatally as well, just to ensure that the collar is properly set. I would air braid the entire thing, but that's me. Now then, what you can do then is, if you wish, in an emergency situation, either build up freehand, you could use a veneer section, place a lateral veneer onto it and cure that, and you could backfill it. The flexibility of this is absolutely marvellous. Would I put a crown on this particular tooth? I would prefer to crown lengthen it. I would want good ferrule on this. To rely on any post system purely on the core, I think, is very, very naive. But certainly as an emergency, I would quite happily place a veneer former over there, an edelweiss veneer, backfill it with composite to get function, and then you've got stability and something the patient can work with while any crown lengthening settles. This is in place. I'm not going to get that out now. It's as quick as any other system. The other good thing is were I to then start re-prepping and modifying this, the tactile feedback is identical to dentine. When you're cutting it with your turbine, it just feels like tooth there. I can't discern a difference.